Now, when this bodhak kapha get disturbed for some reasons, what happens? The process of digestion gets slows down, because then the enzymes which are responsible for digestion that got secreted in the mouth, if it get imbalanced, there will be a disturbance in these enzymes, and salivary gland function sometimes it's not good. So that disturbs the process of digestion, and then whenever you eat food, you will feel like it will not get digested properly. Or sometimes also this happens, like for example, if you are eating food and if you are eating food with a lot of emotional disturbances or something, that is also responsible for disturbing this tarpak kapha, and then our salivary functions get disturbed. You usually have seen, like if we eat food in our disturbed mood and not in pleasant atmosphere, or while in angry mood, you will see that day the digestion of your food will not be proper. So this happens because of the disturbed function of this tarpak kapha. So it is very, very important. That's why in Ayurveda a lot of emphasis has been given, when you are eating food, try to eat food in a silent and pleasant atmosphere, and whenever you are eating food, try to keep yourself very happy, so that your digestion process will happen in a better way. And also these things happen, like when if you are eating food in very stressful situation, or some we sometimes forget to understand like what kind of food we are eating, because our intelligence is not then functioning very well, because bodhak kapha is not functioning very well. We don't know what we are eating, and we don't pay attention. We are not able to even recognize the taste of the food. So that's why it's very, very important, whenever you are eating food, just focus on eating food. Don't focus on watching TV when you are having food. So that would be better for your health and for your digestion. Next kind of kapha which we are going to talk about, it is called avalambak kapha. So I know these words are very difficult in Ayurveda. There are avalambak, tarpak. These all are Sanskrit words that are mentioned in Ayurveda. And it is just for your understanding I am explaining these things, so that you have little idea, like Ayurveda is such a vast and complex subject. Everything I cannot tell on videos to you, but little knowledge, so that you have little bit idea, like Ayurveda is not just a word, there is many mechanisms and principles behind it. Avalambak is a Sanskrit word which means to hold. Like we hold means, anyway if we hug someone we called it avalamban, that is avalambak means to hold. So avalambak, the place of avalambak kapha in the body is upper thorax, and it holds various organs like our lungs, because lungs are not just kept there, these are kept in a very fine lining of fat. That is various layers of, that is like for lungs it's called pleurae, in heart it is called pericardium. So various layers of fat, you can understand it. So this kapha is responsible for holding these organs in their proper places. In addition to that, all these, our trachea, our bronchus, our esophagus, there is everything is set in our body with the layer of fat, like something is holding everything in their place. Not only this, so whenever we breathe, whenever we inhale, exhale, there is a movement of the lungs. So this avalambak kapha is also responsible for lubricating the lungs and reducing the friction between the lung. Otherwise, even two things are just moving, and if there is no lubrication between them, that means what? They will like in vehicles, what happen in cars or motor vehicles, if we don't put oil into it, then lubrication will not be proper. So this avalambak kapha work as a lubricant between various movement of the organs, like in heart, our heart is beating all the time, so it provides lubrication to heart also, it provides lubrication to lungs also. So it's avalambak means it is just holding everything at its place. Whenever this avalambak kapha becomes out of balance for some reasons, because that's why in Ayurveda a lot of emphasis has been given to lifestyle, what kind of food you are eating, what kind of thoughts you are thinking, what are the actions you are doing. So if for some reasons, if it get imbalanced, it generates diseases related to lungs and related to heart. There are many other causative factors also for these diseases, but this is also one of the causative factor that invite various unnecessary chronic ailments. You can also understand it, like for example, it get imbalanced for some reason, then there is sometimes excessive fluid get deposited in the lungs. So this avalamba cough is also one of the reasons for such kind of chronic ailments. But when it is in a balanced state, when this avalamba kapha is in a balanced state, it provides health. But when definitely any dosha that got imbalanced, that produce various kind of diseases, not eventually next day, it takes years. Because it's a chronic ailments, and we know as we know like how chronic ailments develop in the body, slowly step by step they get developed in the body. That's why in Ayurveda a lot of emphasis has been given to yoga and pranayam and meditations, because meditation will bring your mind into peace, and various kind of yoga practices and these breathing practices, pranayam, that will maintain the health of your lungs in a much better way, naturally, without any medicine. So that's why a lot of emphasis in Ayurveda has been given to do pranayam, to do yoga, so that this avalamba cough will stay into balance. It is not only these 5 factors are involved in some disease, there are many other factors associated with it. As Ayurveda doctor, I can tell you, digestive fire is involved, your lifestyle is involved, your family history is involved, genetic composition is involved, what is the emotional and mind patterns you have, that is involved, what kind of region you belong to, that is responsible, what kind of history of present illness is there, that is involved, past illness that is involved, what kind of medicines you have taken, that is involved. So it is like I always recommend and request people, never ever go for self medication, always consult doctor first, and then take medicines or treatment or your lifestyle advice accordingly, because we think by little learning we think okay we know things, but it is not true. There is much more before prescribing any kind of medicine to anyone. The things that we are speaking on this YouTube or through this is just for awareness for the people, like this is how things are there in Ayurveda, so that to understand things in Ayurveda. But it is not like just by knowing these small things we can start treating other people. It's not like that. You need to have proper qualification to treat someone, or proper medical degree to treat someone before saying any kind of medicine for anyone. So these are the general indications, general things which I think everybody should know, so that they can focus on their lifestyle, they can focus on their eating habits, they can focus on the prevention of diseases, and they can also focus on how important is to stay loving and in pleasant state of mind, because how it impacts our body. So if we are trying to adopt Ayurveda in our life, it will help us in these things. So that's the main purpose for making people more aware of Ayurveda, so that they try to shift into more healthy lifestyle, and they will become free from diseases and focus on more preventive aspect of diseases, so that nobody in the world should suffer from any kind of chronic ailment.